Neurological disorders are medical conditions that affect the nervous system, which includes the brain, the spinal cord, the nerves throughout the body. These disorders can impact movement, communication, cognition, sensation, and bodily functions. They may be genetic, acquired, or degenerative. Types of neurological disorders with examples. Category examples: neurodegenerative diseases, Alzheimer's disease, Parkinson's disease, ALS, seizure disorders, epilepsy, infectious diseases, meningitis, encephalitis, structural disorders, brain, spinal cord tumors, hydrocephalus, vascular disorders, stroke, aneurysm, autoimmune disorders, multiple sclerosis, MS, Guillain-Barré syndrome, developmental disorders, cerebral palsy, autism spectrum disorder, trauma-related traumatic brain injury, spinal cord injury, neuromuscular disorders, myasthenia gravis, muscular dystrophy, headache disorders, migraine, cluster headaches. Common symptoms: headaches, memory loss, seizures, numbness or tingling, muscle weakness or paralysis, speech or vision problems, poor coordination or balance. Diagnosis may involve MRI or CT scans, EEG for brain electrical activity, lumbar puncture, blood tests. Neurological examination. Treatment depends on the cause. Medication, for example, anti-epileptics, pain relief, antidepressants, physical or occupational therapy, surgery, lifestyle changes, and supportive care.